Good evening. My name is Martin Luther Neguwekop. I'm a student practical nurse. In this video, I'm going to demonstrate the topical medication administration. For this purpose, I have my MA and I have the doctor's order. So I'm going to go ahead and compare what I have on the MA and on the doctor's order to make sure it's the same. My patient name is Stevenson Rogers, date of birth February 2nd, 1950. Patient ID 4324. So that's what I have on the doctor's order. On the MA, Stevenson Rogers, date of birth February 2nd, 1950. Patient ID 4324. So the doctor's order called the doctor order says to apply Xenoderm ointment to right heel 3 times a day. On my MA, I have Xenoderm ointment to right heel 3 times a day at 800, 1400, and 2000. I see that I have the same information. I will put the doctor's order on the side, and I will go ahead and use just the MA. I'm using the bed rotation number 2. I just forgot to mention that. I'm gonna go see my patient now, but before that, I will clean my hands to make using the hand sanitizer, provide the client privacy. So and then hang up. Good morning. My name is Martin Luther Neguwekop. I'm a student practical nurse. I'm going to take care of you today. How are you today? May I have your name and your date of birth, please? Stevenson Rogers, February 2nd, 1950. Then I go ahead and check and compare what she has on her bracelet, on her wrist. Stevenson Rogers, February 2nd, 1950. Stevenson Rogers, February 2nd, 1950. So the information is the same. Now I'm gonna. And how are you today? Where are we? I checked the level of consciousness of my patient, and she's oriented. He's oriented. So I'll go ahead and do a brief assessment to my patients. And the brief assessment shows that your blood pressure is at 140 over 95. Your pulse is at 9, which is a high blood pressure. The normal blood pressure should be between 120 and 80. So it's the radial pulse is at 95, which is strong and regular, which is within the normal range of 60 to 100. The respiratory rate is at 20 on labor regular, so it's normal. It's between 12 and 20. The temperature, the oral temperature is at 36.5 within the normal range of 36 to 38. The oxygen saturation is at 95% on room air, which is normal within the normal range of 92 between 92 and 100%. And the pain rate is a 6 out of 10 burning pain on ostomy side. So my client Stevenson Rogers is on his 8th day of in post-operative for colostomy, so that's why the pain is there. So the reason why the doctor ordered the medication is because on admission during the assessment we notice a stage 1 pressure ulcer on the right heel. So that's the reason why the medication is required for that, and the doctor has ordered. So the reason for the medication, the Xenoderm, is to use that on your right heel. So I want to talk to you a little bit about the side effect of that medication. So the Xenoderm is used to promote the healing of skin ulcer and the wound. So the doctor has prescribed to apply a thin layer on your right heel. So that's the reason for medication. The side effect could be a stinging or skin irritation. So usually after that it goes away. But if you have a very bad irritation, just let us know, where we'll advise the doctor. We'll stop the medication and advise the doctor. If you have any sign of allergic reactions like rashes, hive, itching, redness, swollen, or if you have any peeling of skin with or without fever, any wheezing or tightness of chest, let us know. Any trouble breathing, swallowing as well, so let us know. And if you have any swelling on your face, your mouth, on your face, on your mouth, your lips, your tongue, or your throat, let us know. We'll stop the medication right away and talk to the doctor. So you have the right to refuse this medication. But if you give me the consent, then I'm gonna go ahead and go to prepare the medication, and I'll come back to apply it. Okay? Thank you very much. I'll be right back. Now I'm gonna go ahead and take my ma and go prepare the medication and do my three checks and 5 rights. So I'm back here now to do the 3 checks and 5 rights. So I pull the drawer. I have my medication here. So I will do the first check. So the first check is to make sure I have the right medication. Xenoderm, so that's the right medication. Xenoderm, right medication. The right patient, Stevenson Rogers, February 2nd, 1950. Stevenson Rogers, February 2nd, 1950. I'm gonna make sure I have the right route. It's an ointment, so it's an ointment. The right dose, it's a thin application. The right time, so it's the right time is at 800, 1400, and 2000. 800, 1400, and 2000. The right frequency is 4 times a day. It says 3 times a day. Sorry, 3 times a day at 800, 1400, and 2000. So I have the right patient, the right route, the right dose, the right time, the right medication. So that completes my first check. So I'm gonna go ahead now and pour the medication. So I have my cup over here, and I have my spatula. So I'm gonna use this spatula to take the medication. I'm opening here, and I'm gonna open my medication as well. So I'm gonna take the medication and pour that in a cup. So once I finish pouring the medication, so I'm gonna cover the medication. So once I finish pouring the medication, I have to label that cup. So I have my pre-made label over here. So I'm gonna go ahead and label the medication here. So, and labeling the medication, I'm gonna complete my second check. So the second check, I'm gonna go ahead and complete my second check. So for my second check, I have the right medication, Xenoderm ointment. So the right route is ointment, the right route is ointment. The right patient is Stevenson Rogers, February 2nd, 1950. Stevenson Rogers, February 2nd, 1950. The right dose is a thin application, right dose, thin application. The right time and frequency is 3 times a day at 800, 1400, 2000. 3 times a day, 800, 1400, and 2000. So this completes my second check. So I'm gonna go ahead and put this medication on my tray now, and I'm gonna complete the third check. So the third check, I make sure I have the right medication, Xenoderm, the right medication. The right patient, Stevenson Rogers, February 2nd, 1950. Stevenson Rogers, February 2nd, 1950. I have the right dose. It's a thin application, right dose, thin application. The right time and frequency is 3 times a day at 800, 1400, 2000. 3 times a day at 800, 1400, 2000. So, and then I have the right route, which is ointment. The right route is ointment. So this complete my 3 checks and 5 rights. Now I'm gonna go back to my patient and get ready to apply the medication. So I'm back here again to apply the medication. So before that, I'm gonna do a brief assessment of the right heel. So for that assessment, because I'm gonna have to touch the heel, I'm gonna have to do to wear gloves. So I'm wearing gloves now to go do my assessment, a brief assessment of the right heel. So I'm going to lift up just the part. So I have the right heel here of my patient. So I'm going to look and I can see. So to do, I'm going to expose the affect. I have exposed the affected area while keeping the unaffected area cover. So this is the right heel of my patient and I'm looking at the ulcer. So what I'm going to do now, I'm going to wash, rinse and dry the affected area before applying my medication. For this purpose I have my cloth here. So I'm going to put that cloth really quickly here now and go ahead and wash and dry a little bit the area. So I'm going to wash and dry the area. So I'm going to start from the more infected area to the less infected area. So once I finish to wash and dry it, and I'm going to keep that a little bit damp. So what is important is that because the skin is excessively dry, I can see that the skin is excessively dry and flaking. So I'll apply the agent while it's still damp. So after washing, I have to remove the gloves and perform another hand hygiene again in order to apply the medication. So it's just, so I'm performing hand hygiene again over here, and I'm going to wear another pair of gloves. That's what we need to do. So, and I'm going to take, so I'm wearing a new pair of gloves, and I'm going to take a thin layer of medication. So I'll place the required amount of I'll take the medication that I have prepared, put that in my palm, and I'm gonna rub it vigorously a little bit in order to warm it up, and I'm gonna apply and spread the medication evenly, on the patient's skin, and I'm gonna use some long stroke in the direction of hair growth. So when the hair is going this way, so I'm gonna apply that to the direction of the hair growth. I'm doing some long stroke right there. Applied a thin layer application. The area will be greasy a little bit at the end of the application. It's because we're applying a thin layer. So after I have finished that, so you will feel greasy, I will remove my gloves first. Once I remove my gloves, I dispose that and I do a little bit another hand hygiene. So once I do the hand hygiene, I will cover the spot now, and I will come and observe that area just to do the right evaluation and see how it's going. You after I have finished that, what I'm gonna do is I'm gonna do the right documentation by filling the time when I have applied that. So I put the time. It's 8:15 in the morning, my initial, and then the date. So to make sure that we do the right documentation, and I will raise back the bed to make my patient comfortable and put the call light over here, and then this will conclude the administration of a topical medication. Thank you very much.